There are 7 words that could save your life, or the life of someone sitting next to you right now, and most people have never heard even half of them. I'm Dr. Michael, and what I'm about to tell you is not meant to scare you for no reason. It's meant to prepare you. Because there is a medical emergency that can happen without warning, without pain, and without any obvious sign that something is wrong. And by the time most people realize what's happening, precious minutes have already slipped away. I'm talking about stroke. Here's the part that should genuinely concern you. Most people think they'd recognize a stroke instantly. They picture someone collapsing. Dramatic. Obvious. Impossible to miss. But that picture is often wrong. And that wrong picture is exactly why so many strokes go unrecognized until it's too late. Stay with me, because in the next few minutes, you're going to learn something that could change how fast you react, for yourself or for someone you love. And near the end, I'll share a number that might genuinely shock you, a number about how many people actually know the real warning signs. Let's start with what's actually happening inside the body during a stroke, because understanding this changes everything about why speed matters so much. A stroke happens when blood flow to part of the brain suddenly stops. Sometimes it's a blockage. Sometimes it's bleeding inside the brain itself. Either way, the result is the same. Brain cells begin dying almost immediately because they're being starved of the blood they need to survive. Think about that for a second. Not hours, not days, minutes. That single fact is why doctors have a phrase they repeat constantly in emergency medicine. Time is brain. Every single minute that passes without treatment means more brain cells lost, and potentially more permanent damage. So if minutes matter this much, you would think everyone would know exactly what to look for. But here's where the real problem hides. In a survey on public stroke awareness, the vast majority of people, 93%, correctly recognized one specific sign of stroke: sudden numbness on one side of the body. That's a good sign that basic awareness exists. But here's the number that should stop you cold. Only 38% of those same people knew all the major symptoms and knew that calling 911 immediately was the right response. Read that again. Just over 1 in 3 people would actually recognize enough of the signs to respond correctly, quickly, in a real emergency. That gap right there, between knowing one sign and knowing enough signs, is exactly where lives are lost. So, let's close that gap right now. Doctors and health agencies use a simple method to help people recognize stroke symptoms in seconds without needing any medical training. It's called BE FAST, and I want to walk you through it, one letter at a time, because each one represents something you need to actually watch for. B is for balance, sudden trouble walking, sudden dizziness, a sudden loss of balance or coordination that came out of nowhere. Not something that's been building for weeks, something that happened suddenly. E is for eyes, sudden trouble seeing. This might mean blurred vision. It might mean vision loss in one eye or both. Again, the key word is sudden. F is for face. One side of the face suddenly looks uneven. It might droop, it might feel numb. If you ask someone to smile and one side doesn't move the way it should, that's a red flag you cannot ignore. A is for arms, sudden weakness or numbness, especially on one side of the body. Ask the person to raise both arms. If one arm drifts down or can't lift at all, that's significant. S is for speech, sudden trouble speaking, slurred words, or difficulty understanding what someone else is saying. Ask them to repeat a simple sentence. If it comes out wrong or they can't do it, take that seriously. And T is for time. Time to call 911 immediately. Not time to wait and see. Not time to drive them yourself. Time to call for emergency help right now. And note exactly when the symptoms started. Now, here's something that connects directly back to that earlier number. All 6 of these signs matter, not just one. Because someone might have sudden confusion and no weakness at all. Someone else might have trouble seeing with no speech problems whatsoever. If you're only watching for one classic sign, you could easily miss a stroke that's presenting differently. There's one more sign worth mentioning, separate from BE FAST but just as serious. A sudden, severe headache with no known cause. Not a normal headache. A sudden, intense one that feels completely different from anything the person usually experiences. Now, here's a myth I need to break, because it has cost people critical time in real emergencies. Some people believe that if symptoms go away, everything is fine. no harm done, nothing to worry about. This belief can be dangerous. There's a condition called a transient ischemic attack, often called a mini stroke. It causes stroke-like symptoms that can resolve completely within minutes. The symptoms disappear. The person feels normal again. But here's the truth hiding behind that relief. ATIA is often a warning sign that a full stroke could follow. The body is sending a signal, and ignoring that signal because the symptoms went away can mean missing the one window where prevention was still possible. If someone experiences any of these signs, even briefly, even if they feel fine minutes later, it still requires prompt medical evaluation. Not next week. Not if it happens again. Now. Let's talk about why speed matters so much medically, because this isn't just about urgency for the sake of urgency. The most effective stroke treatments work best when they're given within 3 hours of the first symptoms appearing. That's the window doctors are racing against. Patients who reach the hospital within that window often experience significantly less disability months later compared to those who arrive after delays. Every minute spent hesitating. Every minute spent wondering if it's really necessary to call for help. Every minute spent deciding to just drive to the hospital yourself instead of calling an ambulance. All of that eats directly into that critical window. And that's exactly why emergency responders matter so much in this situation. Calling 911 isn't just about transportation. Paramedics can begin evaluation immediately, and they can alert the hospital before you even arrive, so a team is ready, and treatment can start faster. Now let's shift for a moment, because there's something hopeful in all of this that deserves your attention too. Stroke isn't only about recognizing an emergency. For many people, stroke risk itself can be reduced. Major, well-documented risk factors include high blood pressure, high cholesterol, smoking, obesity, and diabetes. These aren't mysterious unknown variables. They're conditions that can often be managed through medical care and lifestyle changes. That means for a lot of people, part of this story isn't just about reacting fast. It's about lowering the odds of ever needing to react at all. But I want to be honest with you, because exaggerating this would be irresponsible. Not every risk factor can be controlled. Age plays a role. Family history plays a role. Managing your health can meaningfully lower risk, but it cannot promise complete protection. Awareness and fast action still matter, no matter how healthy someone has been. So let's bring all of this together into something practical, something you can actually carry with you after this video ends. If you or someone near you suddenly loses balance, suddenly has trouble seeing, suddenly has a drooping face, sudden arm weakness, or sudden trouble speaking, treat it as an emergency. Don't wait to see if it improves. Don't assume it's nothing because it happened quickly and seems to be fading. Call for emergency help immediately and note the time the symptoms began. Remember that subtle signs count just as much as dramatic ones. Confusion, slurred speech, a sentence that doesn't come out right. These can be just as serious as someone collapsing, even though they look far less alarming. And remember that a symptom disappearing doesn't mean the danger has passed. Sometimes that disappearing symptom is the most important warning your body will ever give you. Here's something worth sitting with as we close. Somewhere out there right now, someone is experiencing a strange, brief moment. Maybe their words don't come out quite right. Maybe one arm feels a little heavy. And in that moment, they're deciding whether it's serious enough to act on or something to simply wait out. That decision, made in seconds, can shape the rest of their life. I'm not going to end this by asking you to subscribe or click anything. I just want to leave you with one question, and I want you to actually think about it, not just scroll pay-dot. If something like this happened to you or to someone sitting beside you right now, today, would you recognize it fast enough to act? And if the answer feels uncertain, what would it take for you to make sure it isn't uncertain anymore?